Welcome to Cog Talk. I'm here with
Taya
and Angel.
And my name is Lily, and we are talking about DBT, dialectical behavior therapy today. We're going to start off with an icebreaker. Who would like to start?
I can do it. So, for this episode, we're going to be talking about, like Lily said, DBT. So I just want to know your guys' thoughts on DBT compared to our last topic, which was CBT, and how that kind of compares with each other.
I think that I shockingly like DBT more. I didn't think, prior to this semester that would be the case, but after, practicing CBT and, kind of learning more about DBT, I'm a lot more interested in it. And I like, what it's, geared towards, and I like that it seems a lot more, flexible than CBT does.
It doesn't really have that, structure.
Yeah. It's, semi-structured, There's some, but it's not nearly as, strict.
Mm-hmm.
Well, unless you're Dr. Linehan.
Yeah, I like that aspect too. And also, there are so many examples and types of interventions that you can implement. And I like having a big toolbox. And depending on whatever you're working on with the client, you can pull things from the 4 areas that are within DBT. And I feel like that's really flexible and useful for a lot of people, regardless of what they're going through.
Yeah, I think that's completely valid.
Yeah, absolutely. I think that I just love how integrated mindfulness is in DBT and how much of a kind of importance it holds in the intervention process, and how grounding and breathing exercises really has its place. I know a lot of other ones kind of emphasize it a tiny bit, but this one has a really big focus on it. I just really enjoy that aspect of just grounding.
Yeah, absolutely.
I think that's also a great point. Okay, I guess I will be starting. I'm kind of just going to cover chapter 1 of our text, which is just going to be a little bit of history about DBT and what its goals are surrounding it, and just kind of an overview before we get into it a little deeper. I don't know if I should mention what the text name is. Maybe I should. I think it's Principles of DBT. Anyone else have it pulled up? I don't have it.
I know it's by Moonshine.
It is by Moonshine.
In 2019.
Yeah, I think it's just, okay, Dialectical Behavior Therapy, Volume 1, 2nd edition. Yep, by Moonshine. So, just in case we have to throw that in there, that is what this, is going to be based around. Okay, so, DBT was originally founded by Dr. Martha Linehan, beginning in, the 1990s. It was, made specifically for those with BPD and chronic suicidality, and it originally emerged in response to the limitations of traditional treatments and the high levels of clinical burnout, hopelessness, and ineffective care experienced in that population of those with BPD, and chronic suicidality. It's kind of designed to address the gaps that are originally found in traditional CBT. And just for a little background, I'll just give the definition of BPD, since it is such a major part of since it is such a major part in DBT. So from the National Institute of Mental Health, BPD is defined as borderline personality disorder, as a serious mental illness that affects how a person feels about themselves and others and makes it hard to function in everyday life. The disorder often involves difficulty regulating emotions, leading to impulsivity, an unstable or often changing sense of self, and troubled relationships with others. So taking that broad definition in mind, that was what this therapeutic lens was created for. Let's see. Okay, so DBT has evolved over time beyond the rigid manualized approach into more of a flexible and skill-based framework that can be applied across diagnoses, settings, and populations. And then, let's see, sorry, I want to make sure that I hit everything from the history that I can. It is good to mention too that I believe it's a social, correct me if I'm wrong, a psychosocial theory, right?
I believe so.
I'm like, I have it written down somewhere, but I can't
I
find
mean,
it
it
right now.
sounds familiar, but I'm not 100% sure.
Yeah, to my knowledge, it doesn't really kind of interact much with the biological aspects. So I do think it is the
Yeah.
psychosocial.
I'm like, yeah, it's somewhere in my notes here, but I can't
We
find
can maybe
it.
circle back around.
Yeah, sorry. Oh, it is, sorry, a biosocial theory.
Biosocial,
That's what it is.
okay.
Okay. So the main goal in DBT is like to build a life worth living. And philosophically, DBT like rests on dialects, which is holding two seemingly opposite truths at once, particularly acceptance and change. Clients are understood as doing the best they can and needing to learn more effective skills. This is the biosocial theory, meaning it was specifically created to address biological emotional sensitivity in chronic invalidating environments. So before I move on, is there anything anyone wants to chime in on about that?
Yeah, I found in the textbook how it's talking about the biosocial theory, like kind of basing it off of BPD clients, and it's really helpful because they're really emotionally dysregulated, and also have addictions, trauma, or other personality disorders, and that has a really large impact on how they experience their world. And so that's why it's so useful with
I
these
think that's
individuals.
like the perfect segue into why clients with BPD. And that so another highlighted phrase that is used a lot in the DBT world is that clients have not caused all their problems, yet they still have to solve them anyways. So and then kind of skewing from there, acknowledging that reality is subjective for each individual, especially an individual who might be experiencing reality in a different way than other people, is very important because it is subjective, and individuals can agree to disagree on what the experience is. Each person's experience is real for them. We all distort things, fail to pay attention to certain details, pay greater attention to other details, and interpret things in particular ways. BPD clients, or what Lily said, those struggling with addictions, traumas, or other personality disorders, who are highly emotionally dysregulated, and they have that has a large impact on how those individuals experience their world. And these things that they've experienced and with their relationships they have, they may have had behaviors or things where they're confronted and then told that what they're living is not their truth, even though that is their truth and what they're experiencing. And these things happen once or twice. If it happened once or twice, it probably wouldn't result in the current problems. But these chronic and entrenched experiences disrupt typical development. These clients have experienced disrespect, disappointment, and trauma again and again. They have also been unable to access these skills and strengths and resilience effectively. And so you're starting with that kind of client. That's what leads to the clinician burnout and the feelings of maybe not getting anywhere with a client, which is why DBT was structured the way it is and made the way it is to address those individuals.
Yeah, because they really want to be heard and understood and validated.
Yeah.
They've often had problems with relationships, and there's probably a lot of, perhaps some damage there or disconnection, and they're wanting that. And because BPD clients, they have kind of an overstep or a blurred boundary. I think it's really important to keep that in mind when working with them, and that's what DBT is made for.
Yeah, you're hitting every nail on the head for my next segue. But Angel, what were you gonna say?
I was just gonna say that's why, if I remember correctly, that one of the biggest populations for DBT clients were people with borderline personality disorder.
Yeah. Yes.
And that's why they kind of struggle with that sense of connection, and why it works so well. Why DBT is kind of structured to help them out, especially.
Yeah.
At least in my knowledge.
Mm-hmm.
I could be wrong.
No,
Yeah.
that's exactly what it is made for, is these people who, that's why it's dialectic, right? Is you can acknowledge that they've experienced this and validated their experiences, even though it might not be viewed the same way as someone else's experience. You validate their experience, yet you still that's where the and comes in, and understand that they are in need of these skills to learn to change.
Mm-hmm.
Yeah, and or both.
Yes, yeah, exactly. So moving from like validation and change is like a major area to find the dialectic balance in. Understanding validation creates a safe environment and helps build the therapeutic relationship, which then can foster the change. So I'm gonna just talk a little bit about building some motivation and then highlight the 5 components and the 4 skills, and then we will pass it on, and the stages of change, and then I'll pass it on to Lily. So building motivation is a big thing for like these clientele, and like with being like a DBT practitioner, you like finding that motivation with the clients. Clients may have found something that's like that their maladaptive behaviors like benefit. So they're doing their like behaviors for a reason, like this, like they're benefiting in some way. It's working for something. And so you kind of have to compare like the positives of change and the negatives of change, and then the positives of staying the same and the negatives of staying the same with the client to try to find that like motivation. And when it comes to like practicing this theory, it's important to remember that we should like strive with consistency while understanding that it is imperfect. This goes for like clients as well. Practicing skills consistently is highly recommended for clients to build the skills in order to use it effectively. It's also integral for the counselor to regain like, or to like remain non-judgmental to the client and to themselves, and accept that like everyone makes mistakes, and that like that's just kind of like, that's like the basis of kind of like this theory, a foundational key, I guess.
And later on, I'll go more into that and provide some
perfect.
examples.
That sounds
of
great.
The pros and cons list.
So the 5 components of DBT is skills training, which builds behavioral capability, individual therapy, building motivation, phone coaching, generalizing skills to real life, consultation team, which supports clinicians' effectiveness, ancillary treatment, which structures the environment to support change. Then the 4 core skills modules are mindfulness, distress tolerance, emotion regulation, interpersonal effectiveness. And then to highlight the stages of change, they are skills teaching should match the client's readiness for change. Early stages emphasize validation and awareness rather than skill instruction. And relapse is viewed as a learning opportunity, not failure. I just wanted to highlight those like 3 like things that are very like integral, but I didn't want to go in too deep in case you guys were planning on going in a little deeper, but just so that they're highlighted. So I think that's everything I have.
That's a really nice overview, and also just kind of like the reason why DBT is a thing, why it's a theory, how it's used, and the types of people that it best helps.
Yeah, thank you.
Yeah. So kind of going into being dialectical, kind of like how we talked about the and both. Dialectics are about holding in balance things that seem to be contradictory, mismatched, or in conflict with each other. Ironies and paradoxes are solved through dialectics. Dialectics acknowledge that reality is black, white, and many shades of gray. That there are times when there is more than one right answer, and other times when there is no single right answer. Like I said, the both and perspective. So that's from our book. And it's kind of about working towards a balance rather than going to extreme ends, more so in the middle, to see kind of like if one client is on one far end and that's their reality, but the world's reality is on the other far end, trying to pull pieces from the middle ground to show the client, okay, like there's some common ground between each reality. Let's meet in the middle so we can help you out. So common dilemmas clients might face: they don't want to be in pain and they don't want to change. They want their lives to be better but engage in problematic behaviors. They want help but reject support. And they want to be treated like an adult while behaving immaturely. I feel like these are really common, you see with a lot of clients. And so
I was gonna say, I feel like I fall into doing those things all the time.
Yeah, it's like a normal, I feel like it can be normal to feel these, so.
Yeah.
And one of the most practical ways we can help clients holding these 2 opposing truths at once is by doing a pros and cons list. So this is a really dialectical intervention, and it can help us fully validate the client and the behavior that makes sense to them. So on a pros and cons list, if you have the pros side, you want to go through the pros of staying the same and the pros of changing. And then on the con side, the cons of staying the same and the cons of changing. What do you guys think about that?
I think it is like a good way to do what you said, find like that middle ground and find like the reason. I think anything like that incites any kind of change talk to begin with is like a great like launching pad, you know?
Yeah, definitely.
The whole point of DBT of kind of learning to accept two truths or to accept that there's no truth is, I feel like, really hard for a lot of people to grasp. So I do think that pros and cons list is kind of like what Tay was saying, like a really good starting way of kind of introducing that idea that many things can be true at once, and that there is multiple ways to view either yourself or others or the world.
Yeah.
So
And I think even just like getting it down, especially if you do it physically, like on paper in front of you, is very like, because I feel like we always have so much going on in our heads, and like find it, like seeing it in front of you, I think it makes it a lot easier to like conceptualize a lot of these ideas.
We're organizing visually.
Yeah.
Yeah. And so I guess after the pros and cons list, and after you look at it visually, then the second step, look at short versus long-term outcomes of behavior. It's common for pros of the behavior are short-term relief, pros of change are long-term stability, and then while you're kind of discussing this with your client, you want to ask dialectical questions. So you can ask like, what makes it hard to give this up? So that's more of like focused on the behavior of what they're doing. Or what would you lose if you changed? Or what would your life look like in a month if nothing changes? Or in 6 months? So, or if you changed, what would it look like? So kind of like theoretically talking about what would happen if you changed or didn't change, and kind of like a hypothetical scenario discussion, I think can kind of be, it's like perspective taking, you know, you're looking at possibilities that could happen, and also like fostering a more like open-minded way of looking at your life.
I think that's explained great.
yeah, I mean, I
Yeah.
have nothing to add. That's perfect.
Yeah. So if we're gonna go through an example, if the client, and if the client tells the counselor that they're self-harming, which is a common symptom of borderline personality disorder, or in general, they just are self-harming, the client and counselor can make a pros and cons list. And so, like in the pro section, it would be pros of staying the same, continuing to self-harm. And this includes perhaps a sense of emotional relief or release, distraction, or feeling like they're in control. So that can be a pro. You know, those, I know that we want, you know, people in general in society, they just want the urge, like probably the mother of this client is like, don't do that, like we want you to live, I want you in my life, but actually like talking about the pros of it can really help see like, okay, let's look at the other side. So we continue. Cons of staying the same, feeling shame, hiding it, damage to relationships, health, life risk, and guilt, and many other cons. And so looking at it like that, you're like, okay, well, these are all the things that I'm experiencing. This is probably why I'm doing, I'm self-harming. But on the con side, these are things that could be short or long-term consequences. And I think discussing that and looking at both ends is really, I mean, the research shows that it's really beneficial.
Yeah, I agree. It actually like reminds me like, I wish that I would have like, I mean, I knew about DBT, but I wish I kind of like knew like more about it, about like what we've learned, because, sorry, am I okay to give a quick example?
Of course.
Or something? Okay. I have a brother-in-law who, he's more like weary of mental health and like having a complete understanding of it, I guess. So he was talking to me a little bit about it, and he thinks that, or he was telling me that he believes that therapists can be more harmful than like good because they validate bad behavior. And at the time I like kind of was like shocked and didn't really know what to say, but then like looking back, of course, like, you know, in hindsight you like look back and it's like, well, maybe like, and I did like try to explain that, you know, like just because a person's like behaviors may like not be like maybe like maladaptive, like self-harming or like anything like of that sort, it's still like you're not validating the behavior, you're validating their experience in the behavior, because they are still entitled to their own like emotion and their own processing of the experience, because that's how they experienced it. And so it's like, I'm sure I said like a lot of like word vomit to him, and I wish that I like could have been like more structured in like my explanation. But I think like this therapeutic lens would be like very, very beneficial to him to understand. And maybe if he wanted to do like go to therapy, I think seeing someone for DBT would help him, because I think that's like, he's not completely conceptualizing like how you can validate an emotion but not be validating the behavior, because it's not one or the other. You can validate the emotion and want to change the behavior.
Yeah, I think that's like a really good point, like beautifully said, because like it's the behavior that we want to change, but it's not only the behavior that we can talk about. There's emotions, thoughts, and other things behind the behavior that we can validate to help change the behavior.
Yeah, exactly.
Great, I like it.
Yeah, I think that's kind of all I wanted to get into.
Yeah, okay, cool. For my section, we're talking about skills. So on Tuesday, we had a class and we saw just how many skills there were. And there's a lot. There's a lot of different, we're making a little bit of jokes about how the acronyms kind of look and how they don't really make a lot of sense. I thought it was cool that they were trying to make the acronyms be a little bit more like just general words, but the acronyms don't really go well because there's so much in it, but there's just a ton. So I'm gonna talk about a couple of them and also just a couple of like the core aspects of DBT skills. So the first one that I kind of want to talk about was mindfulness. I know I talked about this a little bit at the beginning of this. It is one of the core of DBT skills. It is learning to like observe, describe, and participate without judgment. And I feel like that's something that we were kind of tasked with doing over this last week before class, was kind of just to observe without judgment. How did that go for you guys?
I feel like observing without judgment, okay, I think observing is okay, but with judgment, I don't know. I guess I don't want to call myself a judgmental person, but there's definitely some emotions that came up with that. And also like I tried to observe, like I was sitting outside because I go to the sauna, and I was sitting outside and there's people that pass by, and I kind of want to be in my own bubble, and there's these people talking, and it was kind of like interrupting my flow, you know. And I'm like, I'm just gonna observe them and not let them bother me. So I just closed my eyes and I challenged myself to not like open my eyes and like look at them, like, you know what I mean?
Yeah.
Yeah.
And it's such a subtle thing and they wouldn't notice, but it's like I don't want that disrupting my life. So I actually found it very helpful.
Yeah.
I think it's definitely a skill I could probably improve on and use a lot in my life, because I am someone who's like easily bothered. Like that's like what my husband calls it, is when I'm out in public, I don't like to like, I'm very introverted. I don't like to like be in crowded spaces. I don't like to like be in public because I get like annoyed pretty easy. And so it's like that, like sitting and like not like judging is like something that's like really hard for me, because it's like I'm not just judging to like be like necessarily rude or anything, but
rude,
like
yeah.
it's like for example, we went to a jazz game this past weekend, or the past week, and like sitting there and then like hearing like people talk loud behind me is like, I'm thinking in my head, why are you so loud? Like are you not aware that you're like yelling? And it's like things like that. So I think like sitting and like observing but not letting it like kind of like intervene is something that I like should practice more and be better with, because I think it is a very useful skill, and like not letting things like affect your like well-being as much.
Right.
Absolutely. For me, one of the things that kind of came to mind was when I'm like, I usually take the front runner to go to work. Sometimes a group of like teenagers, extremely loud and extremely rowdy, and kind of like how you guys were saying, like I try not to judge, and I'm trying to do homework and I'm a little bothered, but then kind of I thought about how to be a little bit more mindful, and the thought process that came to mind for me was, I was there at one point, I was that group of people, I was disrupting other people's space, and like it's just things that happen, and like hopefully if I have kids in the future, they're gonna also disrupt people's peace like that.
Yeah.
So like, I don't know, that kind of thought process helped me kind of just observe without being judgmental. And I don't know, I just thought it was a super helpful way to kind of just view how others kind of interact with each other as well.
Yeah,
I
and it
think-
seemed like you had like some empathy there too,
Mm-hmm.
because you like put yourself in their shoes. And you're like, oh yeah, I did that too, so it's more acceptable to me now
Yeah,
because
Yeah.
you could relate.
I think it's like cool that you kind of took like this like almost like transient understanding that like, you know, life flows. You're gonna be those people who are annoying others, and then you're gonna be those people who are annoyed because like your position in life kind of like changes so much, and just kind of like having that like understanding that you're not ever like strictly one or the other is
Mhm.
really interesting.
Yeah.
That was cool.
Thank you. And then next we have distress tolerance. So that would be like skills for like surviving during crisis moments. That kind of involves like short-term coping strategies and for emotional intensity and trying to stabilize oneself. Focusing on acceptance and radical acceptance. And then teaching clients that pain is inevitable, but suffering can be reduced. I thought that was a really cool kind of train of thought to go on.
Yeah, it kind of reminds me of like existential
Exactly.
and maybe a little bit of act in there, a little
Yeah.
sprinkle in.
Yeah,
So that's interesting.
that's what I had thought of as well. Emotional regulation. So this would be like understanding emotions and their purpose, reducing vulnerability to emotional extremes, because dysregulation can make those extremes a lot more potent and a lot more kind of difficult to work with. And then just building positive experiences and learning how to respond rather than react. I feel like that's a really big aspect of emotional regulation. And then just interpersonal effectiveness, so like asking for what you need, setting boundaries, maintaining relationships and self-respect, and then balancing assertiveness with connection.
Yeah.
I feel like those are kind of straightforward. Do you guys have anything to add on the core skills at least?
No, I think you highlighted it great with like the phrase balancing too.
Okay, cool.
Main phrase.
So then I also wanted to see how each of these can kind of look in session. So something like mindfulness, how it can look in session would be like starting with the grounding exercise and gently challenging like judgmental language from the client, such as like, I'm a failure, or I don't enjoy how this person interacts with me, and kind of seeing how it is to kind of step back and just observe rather than judge, kind of how we talked about earlier. And then also one part that I think the textbook kind of emphasized was noticing physical reactions within the body during mindfulness and how the body reacted during events or language or whatever. And then distress tolerance, how that can look in session. So clients can come in overwhelmed and in crisis. And kind of like how we went on a whole tangent about validating the emotion and the experiences that kind of come with events. And to validate that first and then get into teaching crisis survival skills. And then main practice also like self-soothing exercises right there to kind of bring the client back to the present, to the here and now.
Mm-hmm.
I want to add something to distress tolerance. Something that we did like in an exercise last week in my crisis and trauma class, and we used imagery within like especially for a client that is I guess like they don't want to go into the details of the crisis or the traumatic event, but they can express to the counselor whether there was an image or a blank in their memory, or whether that there was like talking or quiet in their memory. So they would just say those exact words instead of go through the entire detailed traumatic event. And there's certain ways that you can like begin with imagery. Like for example, we started like our professor, Dr. Law, was like, think of a churro, think of the cinnamon and sugary outside, and you're holding the churro with your hands and it's sticky, or with the paper, you know, and you like smell the aroma, and you take a bite and it's crunchy on the outside and gooey on the inside, and like, you know, you might be salivating if you like churros, you know?
I am right now.
Yeah. And then we were talking about the churro and how good it was, and then he said, okay, now think of licking a lemon. Isn't that so like, so you can really like start with an exercise that's more on the surface, and then they can get into like the imagery on their own without like going into detail.
Yeah.
And I thought that was really cool. And also with distress tolerance, a skill that's in our textbook is improve, and the first the acronym is imagery for that.
Yeah.
I just wanted to add that. I
Yeah.
think it's very
Yeah.
useful.
Thank you.
That's really interesting.
Yeah.
Thank you.
Yeah, I like that. I like that that approach of doing that. I think it's a really kind of good way to kind of make sure that the client doesn't have to relive that trauma, but
Mhm.
can still discuss about the experiences and the
Yeah.
emotions that kind of came with it.
Yeah, and it's that exposure of
Exactly.
talking about it. And also, then someone DoorDash churros, and then
I
we
was-
all got to like live that. It was great.
I was gonna say I want one now.
Anyway.
Next is emotional regulation, how that can look in session. One of the many skills was diary cards, writing down kind of emotions that are tied to events and kind of how the client felt during that event. So that could be like reviewing those patterns and seeing kind of what comes up, if it's consistent or if it's not, if it's inconsistent. I feel like it provides as much valuable information if it is consistent, even if it isn't consistent. I feel like it kind of shows kind of where the client's at and their ability to emotionally regulate. And then same with kind of identifying emotional triggers and vulnerabilities within those diary cards, seeing if there's a pattern that instead comes with the emotions, the events, and whether events kind of draw out certain emotions for the clients. And then I feel like this one's kind of straightforward, teaching clients to label emotions. I feel like that's something that we kind of overlook sometimes, is that labeling emotions can be really difficult for clients, and teaching them that skill could be very beneficial for not only the client but for the relationship with the therapist as well.
Yeah, and with that you can use like the wheel, you know, like the emotion wheel.
Yeah.
Some therapists have like a pillow of it. I really want to get a pillow, so then it's also like a comfort pillow, and then it also has the emotion on it.
Yeah,
Yeah.
They can
that's
hold
interesting.
during them.
that's cool. I like
That is
that.
cool. I
I'm
didn't know
gonna
that they
get
had
that
those.
too.
I'm gonna
Yeah.
order one.
And then for interpersonal effectiveness, we have kind of like role playing difficult conversations. That could be kind of helping the client kind of see how it is they want to articulate their point of view or their experience to another person. Coaching tone of voice and body language, I think that's kind of a straightforward aspect. And then exploring fears around asking for needs and wants and desires for the client. I feel like this one's a little bit more kind of just there. I don't know, is there anything else you guys want to add for interpersonal effectiveness?
Yeah, I mean, this one's like the main ideas of like around relationships.
Yeah.
And I did a practice session trying to incorporate this, but I don't think it works very well if there's a breakup and I made that mistake.
Yeah.
I think you can definitely use some certain things, but it's like, I think a different aspect of DBT would have been better, so I learned that this week.
Well, like with BPD, a lot of them, like a lot of people who have BPD also, which this was made for, also like experience like kind of transience along within their relationship of like always like kind of like having ups and downs. They kind of struggle with like that relationship building and like keeping a consistent like harmony like within their relationships. A lot of them are very like, there's a lot of like capricious moods involved and things like that. So I think like the interpersonal effectiveness and like working with these like, because like unlike a breakup, you know, like it's kind of like you're like done with that person, you're no longer like having them in your life. But if it's like husband and wife or mother and daughter, father and son who has one of these things, it's like you want to continue these relationships, but there is like that like behavior, like maladaptive behaviors involved, and like the just up and down of the relationship. So I could see where that would be beneficial.
Yeah, that's really helpful for me. Definitely with ongoing relationships that there's tension or conflict.
Yeah, I think it like mainly comes with like the fact that these people, if it is someone who has BPD and they don't realize how their like behaviors are affecting the relationships around them, like, but they like want to continue the relationship, like it's like that kind of like desire behind it versus a relationship that someone doesn't have a desire in continuing.
Yeah, and I know they especially use DBT for like teen, like intensive outpatient or residential treatment centers for teens that like experience self-harm or suicidal ideation or depression, anxiety, borderline, a lot of things. and they use it with like relationship building with like family therapy and like child with just one parent, and I think it can be used in a variety of populations.
Yeah, for
But
sure.
yeah.
And then to kind of end things off, I do just want to say, like I said, there is a ton of skills. There is the Dear Man, there is mindful eating, there is willingness, there's accepts, improves, so many more. So with all these skills that kind of come with DBT, one aspect that the book definitely emphasized was making it fun, making it at least engaging the client in learning all of these skills and learning all of these coping mechanisms to help them kind of live. What was the phrase you used?
Build a life worth living.
Exactly. And to make it fun and approachable, and to not just have it feel like a teaching session. I feel like that's something that we're definitely gonna have to learn as therapists in training, is that it's
Finding the balance.
exactly just like DBT, you know. So like I think that it is important to utilize the skills where they are appropriate, but to also make it engaging in teaching.
I think
Yeah,
that's
really
great.
well said.
Is there anything else you guys want to add? 'Cause that's it for me. That's all I have.
I think we covered
Yeah.
a lot.
Yeah, that was a great discussion.
Yeah.
Yeah. Thank you so much for joining us on Cog Talk.